Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases in Northwestern University Feinberg School of Medicine. Doctor, thanks for being with us.
Good morning.
Hey, good morning.
So a couple of news stories, first of which you talk about 189 Marines had antibodies and they got reinfected, 19 of them with this new variant. That's a little scary.
It's very scary. We don't know if it's all the new variant, but we do know that they had antibodies, in other words, evidence of prior infection when they went to their training, and 10% of them got infected with COVID. That's not good. It probably is the variant, but we don't know yet.
We just mentioned the numbers are down, but it seems there was an increase in children. Is that because of the variant, or is this just a matter of time from the original COVID?
Well, that's a good question. You know, schools have opened up more, so you know, it could just be that could be the thing. Also, if it is the variant, it has been reported that the variant does impact children more than the original virus. We don't know, but it's something that's got to be watched.
The CDC originally said it was safe to reopen schools. Now they're going to announce it again on Wednesday. So are they going back on what they said originally?
You know, I don't know. We'll have to listen to see what they say. I mean, they're trying to get all on the same page here. And, you know, they're going by the evidence, which actually was a study in Wisconsin in the schools that showed that schools that did the appropriate mitigation efforts, you know, the social distancing and whatever, didn't have, the students and the staff didn't have any higher rate than the general community. So, you know, with that kind of evidence, you could say, okay, it's safe to go back. But the teachers are definitely going up the priority list for these vaccines, as you see from the Chicago Public Schools.
The WHO has been trying to track the source of this COVID, trying to learn more about it, maybe prevent the next one. What have they found?
So they went in there with a team of 17 international, highly respected scientists, including one American, and 17 of their counterparts in China. And China has some very good schools and some really smart people in academia and epidemiology. And they've been studying it now for a couple weeks. And so their conclusion as of right now is that it was in the animal population, and from one of those animals jumped to a human. It may have been at this Wuhan market, but now there's even some evidence that it came in from outside of Wuhan. But it does not look like it's a laboratory accident.
All right, let's get to some viewer questions. When do you think the rollout for 1C vaccines will come out? My husband falls in that group with underlying health conditions and heard that it won't be until summer, possibly fall.
Well, I think it's probably going to be before that. But you know, that's a good question. It's just really the supply. They can't go down to the next group. I mean, they still have all these people in 1A and 1B still getting vaccinated now with the supplies that we have. The only way they can go to 1C is if all of a sudden that group is vaccinated and the demand goes down, and then they'll go to 1C. So when is that going to happen? I think it's going to be early spring.
All right, next question. If a person has completed 2 doses of the COVID-19 vaccine and weeks later is significantly exposed to a person with diagnosed COVID-19, should they quarantine for 10 to 14 days due to that exposure? What if they become symptomatic?
Yeah, this is a really timely and good question. Unfortunately, now, even if you've had the vaccine, even if you've had COVID, if you get a high-risk exposure, you have to act like you didn't have the vaccine or prior COVID history. So you'll have to quarantine, maybe as short as 7 to 10 days, probably not 14 days. And if you get symptomatic, you need to be tested immediately.
All right, next question. Should someone with an autoimmune condition get the COVID vaccine? Can it cause more inflammation?
This is another good medical question. The vaccine is not contraindicated in people with autoimmune disorders, rheumatoid arthritis, diseases like that. So they can get the vaccine. You have to have a discussion with their doctor. You know, it's a personal decision, always weighing the risk versus the benefit. The theoretical risk of the vaccine causing an overstimulation of the immune system is always there, but the risk of getting COVID is always there. So you have to weigh the two against each other. Right now, it's leaning in the area of go ahead and take the vaccine.
All right. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to the doctor again tomorrow at this time. Thanks for being with us.
Doctor.